Scar tissue is a huge topic. Scar tissue, it's hard to even have an understanding of its prevalence because no one's asking the question of what's the prevalence of scar tissue as such. People know about the prevalence of cesarean section. They know about the prevalence of episiotomy. Episiotomy is when the perineum is cut during birth to allow the baby to emerge from the vagina without tearing. People tear during childbirth. That's another form or another cause of scar tissue. And then there's injuries. There's injuries like, people horseback riding injuries or bicycle accidents or motorcycle accidents, anything where your legs and your pelvic floor could be impacted by falling with, onto or off of a bicycle, a motorcycle, a skateboard, roller skates, a horse, any of that could create scar tissue in the pelvic floor. Not to mention infections can create scar tissue, surgeries can create scar tissue, radiation can create scar tissue. That's a lot of things that can contribute to scars. So lots of people have them. The prevalence is high. I think something like 70% of women have a problem with some kind of scar as a result of childbirth. It's a huge statistic. What scars do is to create a problem with vascular delivery. If I'm a blood vessel that's going into an engorgeable tissue in the pelvic floor, because women, everyone knows men have engorgeable tissues, penises that get erect. As with sexual arousal, women have many beds, 5 separate beds of erectile tissue in their pelvic floor. And a scar can interrupt blood delivery to these erectile tissue beds. If the erectile tissue doesn't get engorged, then lubrication gets interrupted. It's the engorgement of the erectile tissue bed that drives lubrication from deep into the tissues to the superficial tissues, the superficial mucosal membrane of the vulva. So if there's a problem with vascular delivery, the blood can't get to the engorgeable tissue, and there's an interruption like a tear or a surgical incision in the mucosal membrane itself, like there is during an episiotomy, that can really shut down lubrication. If there's no lubrication, sex is going to feel pinchy and painful. And so this is what a lot of women report after childbirth is pinchy, painful sex. But they know something's changed, but they don't know what. They don't know what happened to their juicy sexual function that used to be there. So now they're feeling maybe less desire because maybe they're still breastfeeding and hormonally they're producing less lubrication. But if there's an injury or a surgery associated with childbirth, that can contribute. Even cesarean section, which you think doesn't affect the vaginal floor, certainly can affect vascular delivery to the vaginal floor. There'll be less lubrication, more painful sex, and that's even going to contribute more to women's feeling around low desire, or there's something wrong that used to be functional, and now things have just changed because now I'm a mom. And now my attention's going to my kids, it's not going to my partner, and there's nothing I can do about it because the doctor told me I was fine to have sex, but it doesn't feel the same as it used to. It's still painful. And so the good news is, yes, there are things that can be done. There's self-help things that can be done. There's help from a professional that can be sought. And there's a profession that's available to do this work, and it's called Sexological Bodywork. I got into sexological bodywork as a way to give me scope of practice to pursue scar tissue because I was told by one of my early bodywork teachers that this was an area in deep need of exploration.